Hey there, everybody. Welcome to today's episode where we are going to be discussing something which seems to be a bit of a problem where every dentist just believes they're a one man army. The truth is, we are nothing without the wider dental team. There are so many different hands involved in dentistry that if we don't actually maximize the use of it, we're pretty much on our own. And the only person suffering is your patient. And that's never good when it comes to dentistry as a career, from general dentistry through to dental nurse, assistants, therapists, hygienists, and the like, all the way to the lab as well. So that's why my guest today, a very special guest, is Harjot, who's coming to us as a dental therapist. Believe it or not, believe it's the first one that we've had on the show, which is great to have. And I'm going to hand it over to her for a quick introduction before we dive into what exactly that entails, how do you get involved with doing it, what the day-to-days are looking like, and so much more. So, Harjot, over to you if you'd like to give yourself a nice introduction, and we'll take it from there.
Lovely, thank you. So my name's Harjot. I'm a dental therapist. I qualified back in 2019. So since then, I've worked in community dental, and currently I do a mixture of private and NHS therapy and hygiene.
What does it take to become a dental therapist? If you start us off from the education upwards.
Education. So back when I did it, you needed A levels. So
Yep.
the university that I went to was University of Birmingham. So at
Nice.
that point, you needed minimum A, B, B, and you definitely had to have biology. And then that gets you into a degree which is called BSc Dental Hygiene Therapy.
Nice.
I know I think in Scotland it's called Oral Health Science, so it's the same thing really. Um, there are a couple of schools where you can do just dental hygiene,
Okay.
and there are places that do a diploma in hygiene therapy as well.
Right.
Um, but at the end of it, you will come out with the same qualification. You get registered as a therapist or hygienist.
Nice. And how long is the course?
So it's 3 years for a degree. I believe diploma, I think, is around about 2.5, just
Okay.
because they don't do the dissertation. That's the only difference.
Right. Okay. And then obviously, so you finished that in 2019. We're fast forwarding now 6 years. You've got quite a lot of experience under your belt. What is it like in terms of getting on to sort of that career ladder? I know with like dentists, they have to do the foundation training. Then it's a case of, mixed practice versus, all private. You're mentioning now that you're doing private work. What does that look like for you guys before we get into kind of what the work looks like?
So there is a kind of a VT scheme, which is sort of similar to the dental foundation training.
Okay.
But there's some very, very limited places around. So most of us don't actually do it really. We don't really
Okay.
kind of either get onto it. Generally, you're kind of thrown straight into practice.
Oh, nice.
So if you get, yeah, a bit of a baptism of fire. But if you get a good like supportive practice that are used to kind of having newly qualified people, or they're really supportive and they're happy to answer your questions, then usually you're okay, really, after a
Okay.
while. I think it's just the initial shock of going from dental school and having those really long appointments, having your tutors around you, to kind of actually having your own surgery, really, you're your own patients.
And then let's actually dive into that. So when it comes to the working aspect of it, explain dental therapy. I've heard so many people try to slag off everything when it comes to dentistry. I've got dental hygienists cussing out dentists. I've got therapists saying, so and so isn't necessary in the workplace. And obviously, dentists hate everyone, it seems, like anybody who isn't a dentist is just not good enough, right? So why are there so many divisions? Why is there a hygienist? Why is there a therapist? Why is there a dentist? What are they doing differently? What is specific to one that isn't to the other? Where are the lines blurring? Give us some explanation behind that so we get a bit more understanding.
I think the reason why you've got your hygienist, your therapist, your dentist, I think it is basically they've all got their own sort of specialties and things that they can do.
Okay.
And you're all kind of working together to make sure that you give the patient the best care. To say with hygienists, we usually say to the patients, they're kind of like, they deal with the gum disease, dentists do the teeth. That's kind of how I sort of simplify it for some
Nice.
patients. They're really essential in kind of prevention, management of periodontitis, um, and making sure that the patients have got those strong foundations so that they can keep their teeth for longer. And
Ah,
also, especially nowadays, with kind of like people finding links between periodontitis and Alzheimer's,
Yep.
and things like heart disease. I think like the hygienists are definitely getting more and more important, helping patients sort of prevent other health issues in the future.
Right.
Um, Therapists and dentists, that's kind of where I think sometimes people can get a bit confused as to what we all kind of can and can't do, really.
Yeah. Yep.
Um, yeah, so therapists, you can do, well, now you can do direct access cuts.
Okay.
Um, so you can do your fillings, your scales and polishes, your visual sealants. You can take impressions,
Oh,
um, and you can do pre-formed metal crowns
wow.
on children's teeth. And obviously, if you have got the qualifications, you can do other things like teeth whitening, obviously under
Wow.
prescription of a dentist.
I'm like,
Um,
I feel like the dentists are going to be running out of a job soon. This actually seems like you're pretty much covering everything here. So, okay, carry on. I'm liking this. This is pretty
yeah.
interesting.
Yeah, so then obviously that kind of leaves the dentist's space in their diary to do like the bigger treatments, more like private treatments. So if they wanted to start doing things like implants, or if they need to do any sedation or anything like that, they can do the bigger, longer, complex treatments and the ones that kind of earn more money for the practice.
Okay, I'm with you. I'm with you. And is there like, when we talk about partnerships and teams and how they work together, and is it a case of, dentists and dental therapists can work hand in hand, or is it very much like you're nicking all my work? I mean, I know you mentioned there that it gives more time for dentists to maybe do some
Yeah.
of the longer procedures, or whatever it may be. But could it also be that you are taking work away from each other, or is there actually a way to have that synergy between you two? Like, how do you do it in your workplace?
Yeah. I think there is sometimes um, a kind of thing of dentists like, oh, you're taking my work or anything like that. But I think if you once you get a therapy sort of model set up in your practice, it does work.
Uh-huh.
Um, so especially nowadays, obviously we've got issues with patients accessing NHS dentistry. So that's kind of where the therapists come in. They can do kind of exams and fillings, and like scales and polishes, like band tooth perio treatment. Um, and the dentist can also see any NHS patients they want, maybe those who are a bit more complex, maybe need dentures or root canals.
Right.
So it's just improving the kind of access for patients. They can access a clinician a bit easier.
Okay.
So you've either got the therapist book or the dentist book, and they can kind of at least they can get in and see a professional.
I like it.
Um, yeah. Also, if or sometimes dentists do want therapists to do mainly NHS work, and then they do mainly the private work. It just kind of depends on the practice and what the staff kind of decide they want to do, really.
And then are you finding that, obviously with that in mind, that it depends on the practice, are you finding that it is something that practices are adopting, or do you feel as though it's kind of a bit more of a niche thing, maybe depending on location, how affluent the patients are in that area, that practices want to have a space for therapists? Like basically, what I'm trying to allude to here is it easy enough to find work when it comes to being a dental therapist, or is it quite tough? Is it quite competitive? What's it like in that space for you guys?
I think at the moment, because there aren't a great deal of therapists
Okay.
in the UK at the moment, and also I don't think many practices know really how to incorporate a therapist into their practice as well. So
Okay.
at the moment, it is quite hard to find a job, like therapy wise. So a lot of us tend to do maybe private hygiene
Okay.
a few days a week, and then 1 or 2 days therapy. So you won't really get like full time therapy at the moment. But I think it's something that will become more popular in the future as kind
Right.
of practice owners kind of cotton on, how they can utilize a therapist really.
I like that. I think the idea there is quite good actually. It's kind of bringing in that middle ground almost for patients to say, as you quite rightly said, when it comes to access, you're not always going to get a dentist on hand to be able to see, but then obviously you've got therapists that can deal with what sounded like about 70-80% of what dentists are doing anyway. All of a
Yeah.
sudden being able to do that, it's just more hands on deck, isn't it? So again, I've completely not done any research on this. I'm going to ask you stuff you may not know the answer to, but when it comes to dental therapy, is it a case of it's been around for a long time and just not utilized well, or is it a relatively new thing that is being adopted slowly over time? I know you're saying that not many people are, taking advantage of it just yet. But is that due to maybe how young it is in terms of comparatively to things like being a fully blown general dentist?
Yeah, I think therapy has been around for quite a while,
Yeah.
but I think they were for quite a while used mainly in community,
Okay, right. I'm with you.
as opposed to general practice. And I think
Ah,
there are now more therapists. I know like therapy schools are increasing the amount of places
great.
for their intake of students. I think people are definitely kind of like thinking about therapists now and how they can be utilized in the dental team.
I'm with you. I mean, this is good because I mean, if we can bring more people in that maybe don't want to take on the responsibility of being a fully blown dentist, but really like the idea of dentistry as a whole. I know that
Yeah.
some people may have missed the mark when it comes to their A level grades, for example. They're really passionate about it, but they've got no way in. They don't know where to go with it. I mean, honestly, this sounds great, and it's a quicker course as well. It gets you straight into
Yeah.
the deep end. I guess the next question really is, where does it go, right? Because you're going to get the argument where dentists come in and say, well, I can do X, Y, and Z with this. But from what I'm hearing with you, you're doing everything right under the sun. So how does it progress for you guys? Where are the career paths? What courses can you go on? How diverse can you make your typical day? And then we'll go into like whether there's anything in terms of ownership, because I know with practice ownership you need to be GDC registered, but then could you be a therapist and do that as well? So if we wind this all the way back, what does the progression look like for a therapist if they wanted to go completely all out?
So you can do a lot as a therapist. So you can obviously, provided you undertake the training, composite bonding. I know
Amazing.
quite a few therapists do composite bonding. They're doing composite veneers. They've gone more kind of down that aesthetic route.
Brilliant.
Providing you've got a dentist that can examine the patient about prescription, you can do tooth whitening.
Uh-huh.
Um, Facial aesthetics. I recently trained in facial aesthetics. So you've got your Botox, your lip fillers. Um, or you could go down another path. If you wanted to do lecturing, you could be a dental therapy tutor in one of the
Oh,
dental
of
schools
course,
as
yeah.
well. Or you've got community.
Right.
If that's something that you wanted to do, you could go into things such as special care dentistry. So you're dealing with patients that have got like special needs, really phobic patients as well. So
Right,
it's a
right.
wide variety of opportunities that you have. It's just kind of deciding sort of what route you want to go down and what you sort of want to do, really.
Very great stuff. And let's talk about the facial aesthetic side of things, because this is something that I speak to my especially female colleagues at university, and this is something that a lot of them do. I'm not saying it's only females that do this, but I'm just saying that
Oh,
it seems that they know more about it than us guys, right? And they have got so many great ideas in terms of when I finish, this is the course I want to do, yada yada, and I would love to go into facial aesthetics. So you mentioned things like lip fillers and Botox, and there's a lot of money in this. As a society, we are, so aesthetically concerned nowadays, probably due to social media and just raising sort of beauty standards and whatnot. Getting into that, what does that look like first and foremost? How do you pursue that? How long does it take? How much do you have to invest into it? And I'm guessing there's probably a level. You don't want to just get in at the most basic, rubbishy, amount of facial aesthetics. What's kind of almost the gold standard? What's the route you took? How long did it take? How much did it cost? And do you see it as worth it, or is it way too competitive now in the market? Like, how do you make the most of it by being a dental therapist doing facial aesthetics compared to the beauty parlor down the road that seems to offer the same thing? So guide us through that entire journey, if you would.
so I was thinking about facial therapy for quite a while. So I did quite a lot of
Okay.
research into it and thinking, is it worth maybe training in something new? This is kind of like my 6th year being qualified. I actually found a course that somebody recommended to me, and it was done by a trainer in Liverpool, and he does one-to-one courses.
Oh, nice.
So it was a day course. You have your models. You train with the dentist one-to-one. And as a therapist, you do need to make sure that you've got a prescriber as
Right, right,
well.
right.
Obviously, because we can't prescribe.
Yeah.
Um, it was really, really good. So the course doesn't take too long. It's literally a day. I think the kind of hard part after that is actually getting the clients,
Right. Yes.
getting the interest. and kind of just sort of growing your book from there, really.
So what's your advice on that as well? Because I mean, I think this is quite, you can transfer this over to private dentistry in general as well, can't you? Because you're using those same principles. So you've got a skill set, so many other people have that same skill set, but you're trying to get that out there. So how do you become successful in doing that? What's your kind of core principles and best tips and tricks for anybody out there that wants to, you know, A, do maybe this same strategy with facial aesthetics, and B, just generally in terms of any business offering that they may have?
Yeah, honestly, I'd just say word of mouth,
Oh,
and
okay.
also Instagram. I've got a dental Instagram, so people can kind of like see your work there and see what you do. I'm quite lucky to have been at a couple of my practices for a number of years. So if I say to my patients I'm doing facial aesthetics, I give them one of my business cards, they will then pass that on to somebody else and let somebody else know, purely because they've known me for years.
Yeah, yeah,
Um, yeah, so like leaflets, business cards, and then just kind of making sure you've got some sort of online platform as well,
right. So it's
just to
so it's not a
showcase your
case.
work.
Oh, I'm with you. So it's not a case of like chuck loads of money into like Google AdSense and all that sort of stuff. It's, as you quite rightly said, organic growth. Work with people that you know. And how long has it been since you went on that course? Like, when did you actually have that course in hand? When was that date?
So it's literally been a week.
Oh no way! Okay, right. Okay,
Yeah,
there you go.
it's been a
This is
week,
how this
but
is how little I prepare for my podcast. So there you go.
so it has been a week, but what I did was because I knew for a few months that I was booked onto this course.
Of course, yeah.
So I kind of started talking with staff about it, patients about it, said, obviously after this date, I'm going to be offering facial aesthetics. So kind
Amazing.
of already getting the interest really and getting people kind of excited about getting like a consult. So I was offering free consultations with my prescriber. So
Ah,
people excited to get a free consultation and then they'd get the Botox. So just so that kind of planting the seed really,
I
just so
like it.
thinking
What
about
we
that.
can do, if you want, we can have like a little discount for any of the listeners to go over to you and get their facial aesthetics done if you want, and I just forward them over to you. And so long as they sort of reference this podcast, we'll see if we can get you a little discount, guys. Because surely
Brilliant.
somebody can take them on. Yeah, exactly. That's that. I think it's good advice though, because when it comes to anything that you're offering, I think people have so many ideas as to how to do it, but they've never implemented it, right? So hearing it
Yeah,
from yourself, I think that's so important, that if you know you're about to do something, don't just wait until you have it done and then start advertising for it. And I think, to be honest with you, I'll probably miss that trick myself. So it's really good to hear that from you. And I think that we should really try to use that advice. And I think even myself, after hearing everything from yourself and from my colleagues, facial aesthetics is definitely something on the table for me as well. And if you're saying that only takes a day, oh, did it cost you an arm and a leg, or was it, relatively affordable?
so it was £998,
Okay, that's not bad. That's not bad at all.
which if you consider like how much money you're going to make back from that, and it's a new skill that you can learn, it varies up your day a little bit.
I'm with you.
It was really good to learn it. Yeah, definitely, it's
Ah,
very interesting.
I love it. I like the fact that the ROI is there quite quickly. In terms of treatments, I mean, give us some breakdowns of roughly what your menu would look like. So how much is typically lip filler? How much is typically Botox? So then we can kind of work out how quickly you'd be making that money back anyway from, spending on the course in the first place.
Yeah, so at the moment, I've started out with just Botox,
Okay, cool.
just kind of get the ball rolling, and then as I get more sort of loyal clients, more interest, going to lip fillers.
Nice.
So at the moment, say for one area, it's about £175.
Ooh.
Yeah,
So it's
yeah,
not going to take you too long. Probably like, six-ish. My maths is rubbish, but about six-ish patients, and you're pretty much done, right? You paid off your investment. That's
yeah,
amazing. That is actually
yeah,
really,
and
really
then
good.
yeah, the price
Is it?
goes up obviously if they have 2 areas or 3 areas done.
Of course, yeah, yeah, yeah. And in terms of Botox, like how there's so much kind of negativity around it. We've heard all the horror stories, right? But in reality, I know that when it's administered correctly from somebody who's had the training, i.e., from somebody like yourself, then it's a great option to have for facial aesthetics. People are using it in terms of like TMJ disorders or like masticatory muscle disorders, etc. So it has its benefits, right?
Yeah,
What is
definitely.
what is yeah? So what is the kind of trick behind it? I'm not asking you to reveal the secrets of the courses that you've been on, but what's the tricks behind it to make sure you're not botching jobs up, and that you're giving customers what they want without making them look like, Barbie dolls, or, get stuck in a certain position for the rest of their lives. So what's the difference by coming to somebody who's a skilled practitioner like yourself?
I think it's because obviously as dental professionals, we already know head and neck anatomy. We're really used to injecting the head and
Yeah,
head and neck area, really.
exactly.
And also because we use sort of like licensed products, obviously that only like a prescriber could be able to get. And you sort of just chat with the patient and see what they want. Do they want a full frozen look? Do they want more of a natural look? And then you kind of just sort of adjust the
Oh,
dosage
I love
that
that.
you give them, and sort of it depends on sort of where you pop it as well, really.
I love that.
But yeah, as long as you've kind of got an idea of what the patient wants,
That
really
that
kind of
is.
just work with them.
I feel like we don't think about this enough. It's so true. Like, you've literally gone to uni and studied this inside out, and you know where nerves are, where blood vessels
Yeah,
are. And as you quite rightly said, you've been working with needles for such a long time. This is like second nature.
yeah.
That's something that, when you go to these, as I mentioned earlier, that sort of beauty parlors that offer this kind of treatment, like, who would you put your trust in, really? You got your
Exactly.
face. This is like, the biggest part is what everybody's looking at. Who would you put that trust in? And if it does maybe cost the extra 10, 20 quid, it's just worth it, because you're definitely in a more safe environment. And I think that should almost advertise for itself. So I think you're doing a good job.
Thank
Hopefully
you.
now, it's only been a week. Yeah, it's only been a week. It's only going to pick up 100%.
Yeah, it's
And then
very early.
in terms of kind of like then the future, right? So this is really nice to see you're branching out. You've only been qualified five and a bit years. Where does it look to shape for you, and how do you see things growing for yourself? Like, what are the avenues you haven't explored yet that you want to go into, or where do you see yourself ending up in the near future?
So at the moment, I probably think I tend to try and do a bit more private work,
Okay,
um, really, and kind of grow the facial aesthetics business and kind of see what the future holds, really.
great stuff.
Um, yeah, because I think at the moment it's so kind of hard to get therapy work, and also with the state that the NHS is at the moment, you kind of sort of don't know properly what you're going to be doing in a couple of years. I could end up doing more NHS work if the need is there, which I'm more than happy to.
No, that's
Yeah,
amazing. And I think, before I kind of wrap up, I did want to kind of pull it back just a little bit, because I feel as though we haven't really discussed your opinions on teamwork, etc. What's kind of the stories that you have, or the advice that you would give to people when it comes to teamwork, especially in the dental workplace? Why it's so important, and how to kind of maximize that efficiency between the members of the dental team. Like, kind of give us some insight from your perspective, because you're there at the moment. You know what works, you know what doesn't, and what kind of mindset is the one that's going to help grow and everyone succeed in doing well. And what are those typical mindsets that maybe you've seen that are toxic, that don't work, and we should all completely avoid, in your experience, if you could.
I think definitely going with the mindset that every single person has got something to offer in that team, and they're all like very important. Without a certain team member, the team's not going to be able to work.
Yeah,
um, and you treat them all with respect. It doesn't matter what role they've got. So, for example, like my dental nurses, I could not do my job without my dental nurses. They're absolute gold. Yeah, they have taught me so much stuff that I wouldn't learn in dental school. I worked with a dental nurse for about 4.5 years. Met her when I was newly qualified, and she taught me so many kind of
wow,
people skills, ways to work with anxious patients that you wouldn't otherwise learn in lecture theatre.
of course not.
Um,
Yeah.
yeah, everybody's very important in the team. Yeah, they've all got their own role. You treat them with respect, and you all are absolutely fine.
And have you seen, like, in your career to date, maybe situations and scenarios where you yourself have felt kind of maybe disrespected by people or undervalued? And if that's happened, like, how have you dealt with that?
I think definitely as a hygienist or a therapist,
Okay.
you do sometimes feel undervalued,
Right.
or sometimes a little bit underutilized.
Right.
I'd
Okay.
say. And I think it's possibly because not every single dentist or practice owner or anybody has that kind of knowledge of the full scope of hygiene or the full scope of a therapist and how you can actually properly utilize them
Mm-hmm.
for the benefit of practice profit and the patients as well. So I think it is just kind of like educating people more about what we do, really.
I'm with. Is
So
that how you typically deal with it? Because it must be like I'm quite. I'd say I'd like to say I'm thick-skinned, but I know for a fact if somebody said something to you to me and I felt undervalued, I'd probably lose it. Right, like head would just completely pop. You seem quite chill, calm, and you can see it maybe from a different perspective. So, what's the advice you'd give to us in terms of dealing with that? Because you're going to get people that listen to this that are dental students, for example. There might be dental therapy students, whatever it might be, students in general. And whenever they go into the real world and they're suddenly the newbies at work, whatever work it might be, they're always going to feel undervalued. They're always going to probably hear some schneidi comment, right? How do we deal with that? What's your advice for anybody listening? Because you quite rightly just said that it's kind of happened to you, and you felt that way. So give us some tips and tricks there, so we can take that on board.
I think it depends what comments they're making and who it's coming from.
Right, right.
But also definitely make sure you've got a good relationship with your practice manager, your principal dentist. You can and just have like a chat with them about what the problem is, solutions to the problem, and just see if you can kind of meet in the middle somewhere. I've always found if I'm very open and honest with the people that I work for, and it's a really good way to kind of go in, really.
Oh, yeah.
They
So
respect you, you respect them, and you can kind of just come to sort of an arrangement to solve
yeah.
whatever issue is.
So it is about communicating. It's not just a case of bottle it up and just I'll show you kind of thing, but try
Yeah,
talk it out almost. Yeah, I do like. I think especially in kind of modern times as we are now, we can't just go out and burn someone's village down just because they said something. It's definitely a case of communicating now there, which is
yeah.
thank you for that advice. I think we all needed it from a calm head like yourself. And one thing I mentioned earlier, which I'm just remembering before I completely forget it, was in terms of ownership. What's the situation with dental therapists and ownership of practices? Is there anything there, or is that something that's not in their scope? Like, how does it work? Do you know anything about that?
You can own a practice.
Nice,
I do know a few therapists who do own practices.
amazing,
Yeah, so I didn't mention before. Actually, that's another route you can take down as well. If you're a therapist and you're interested in owning a practice, you can.
amazing.
Um, yeah, so that's another opportunity if
That is
anyone
that
out
is
there is interested.
the reason why I asked that is because I know what we discussed, kind of career paths, routes, and how to kind of add more strings to your bow as a therapist. I know a lot of people having they're very business minded, they're very numbers driven, finances. They're great at setting up business. They might be terrible when it comes to speaking to people. So this is their strength. So it's nice to know for those people that want to get into maybe
Yeah,
starting their own business, the property ladder, turning that into a clinic, and then maybe branching out. They can do that with this route as well. That it's not just you have to be a dentist and that's the only way you can do it. So it's good to get that
no,
information. Um, I feel as though it is going to be a case of over time, as you quite rightly said, people need to wake up to this and utilize dental therapy a bit more.
yeah,
And up until that point, I think it's just up to us as a whole to educate each other on everybody has a reason within that dental team. It's super important, and without each other we can't really function. So just to kind of wrap it off, what would be your parting advice to anybody listening when it comes to just working as a team, their options as to getting into dental therapy, for example, and just anything that you want to sign off with?
um, working as a team, just make sure you all kind of see each other as equal, have open communication with each other. If there's an issue, um, just keep in mind that you're all working together for the sake of the patient. Dental therapy wise, it is hard to get therapy work out there. It's very hard to kind of make people see at the moment why you need a therapist in practice.
Yeah.
What I'd say is try and talk to your principal dentist, try and talk to your practice manager, about how a therapist can help increase, practice profit, and also can help patient access dental care a bit more as well. And you will see, you might get there, and you'll probably get a bit more therapy work as well.
I love it. Absolutely great stuff. So if anybody wanted to kind of see your work or get in touch, is there any way that they could do that?
Yes, so my Instagram is harjot.dental. So if anybody needs to drop me a message about anything, or you just want to see my work, feel free to go ahead.
I will leave that in the description box below, and it will probably be floating above your head throughout this entire podcast. So we'll fix that at some point and get that going. And I think, from me, thank you very much. Always love having insight from my guests. I almost purposely don't like to research things, because I actually want genuine answers to genuine dumb questions, and that's the way that I like to perform this. So thank you very much for giving me your time and coming on. I'm sure that we've all learned something, and for anybody else who wants to get in touch, please do. Harjot's really nice in terms of communicating and very open and honest with sort of her responses. She's been doing that for me as well, and I thank you for that. And if you guys have any comments or feedback, please leave it in the comment section below. And as always, thank you, and I hope to see you all on the next one. Take care and goodbye. Alrighty.